Welcome to Healthy, Wealthy, and Wise. We're so glad you've joined us today. We know that our health is actually our greatest wealth. Without health, no matter how much wealth you have, it's not worth a whole lot, is it? So we want to draw your attention to some things that can make you healthy, wealthy, and wise. We want to emphasize prevention. We want to go through a lot of topics that will be of benefit to you, questions that you might have, and be sure to contact us at LLBN TV if you have subjects that you'd like to have considered and perhaps some questions that you want to transmit to us. We're delighted today to welcome to our show Dr. Carl Bauer, a gastroenterologist. His specialty has been taking care of people with gastrointestinal problems all the way from the mouth down through the colon. He's also a Master of Science and degree recipient from the University of California, Davis, in nutrition. So he's an excellent person to ask a lot of questions about this area of our body that has to do with so much with our total health. And today, Dr. Bauer, we want to address at least one of the problems that is the second most common cause of cancer death in this country, I understand, and that is colon cancer. It's a tremendous problem and a lot of things that can be done to prevent it. As a matter of fact, I think we were talking earlier that it could be a totally preventable disease. So tell us a little bit about that, Carl.
Colon cancer affects about 150,000 Americans each year, and of these, about 50% die.
Oh my.
So it has a mortality risk that is fairly high, and the reason for that is that many of the patients who are discovered to have colon cancer have it at an advanced stage when it isn't very treatable. There are a number of causes of colon cancer that are perhaps worth talking about.
Sure.
Colon cancer can be hereditary. There are now genes that have been well defined that predispose to colon cancer, and but that only accounts for about 1% to 2% of the total number of cases.
Well, that's good news, because if it were more genes, then there's not much you can do about that except be aware, and that's one of the big points actually, is to be aware.
That's right. But it does mean that if you have colon cancer at an early age and a constellation of people in your family who have had it, then you may be one of those, and then the whole surveillance for the problem takes on a totally different nature. That is, you need to have evaluation sooner and more frequently than you would if you had the ordinary kind.
So starting at a younger age, then you need to be seeing the gastroenterologist to get the screening done.
Right. A second cause of colon cancer is chronic inflammatory diseases of the colon, such as ulcerative colitis and Crohn's disease. When one has had either of those diseases on a continuous basis for more than 10 years, the risk of colon cancer goes up strikingly. But most cases of colon cancer occur from benign polyps that grow in the colon, and we don't know precisely what causes them to grow. They are neoplastic polyps that develop anywhere in the large bowel and grow slowly over a period of years, and as they get larger, they become malignant. The lifespan of a polyp from the time it first is visible until the time it becomes malignant is something around 5 years. And so if polyps are removed during that period of time, colon cancer can be prevented. And so the key thing about this whole issue is, I think, having appropriate surveillance to remove benign polyps before they become malignant, rather than treating a malignancy after it develops.
Of course, a benign polyp means that there's no cancer there, but the chances that cancer might develop seem to be pretty high given that kind of situation.
That's right. A number of studies in the United States have shown that 10 to 12% of the American population have polyps. And these polyps, not all will become malignant, but many do. And so one cannot tell whether your polyp is going to become a cancer or not, but when it occurs in that high a percentage of the population, the wise thing to do is to have them removed. And they can be removed with a colonoscopic examination at the same time that the diagnosis is made.
So if you are in the situation where you don't have any hereditary background, you don't have parents or relatives that have had colon cancer, then what would be the earliest age where one should consider having this evaluation done?
Well, the American Gastroenterological Association and other groups that have studied this issue have concluded that the first time that one should have a colon examination to look for polyps is age 50. And if none are found, fine. Then you don't need to have another one for 10 years. If, however, you have polyps that are found and removed, then you should have a recurrent colonoscopy at 5-year intervals, since it takes about 5 years for a polyp to become malignant.
So I guess the sum here, or the bottom line basically, is that if you have no polyps at age 50, the chances of getting any after that are not as likely, and so you can wait a little bit more in between those examinations.
That's correct.
But from my standpoint, I mean, if it's me that I'm talking about and there may be a polyp developing there, I want to find out about that. Do I have to wait 10 years, or are they going to let me do it at 5?
5 years. The good news is that Medicare will pay for a screening examination of your colon from age 50 on every 5 years.
Well, then I'm for the 5 years. I mean, why wait till 10 when that thing could be growing? So how would we prevent these? Well, you're not going to prevent the polyps, I suppose. Can you prevent the cancer incidence?
There are a number of things that have been shown to be predisposing factors for the development of colon cancer. These include obesity. People who are obese have a much higher incidence of colon cancer than non-obese people. A high red meat diet is a predisposing factor. A number of studies have shown that to be the case.
That's interesting. I hadn't realized that it was the red meat that seemed to. So if you're eating fish, it's not quite so much a problem?
That's correct. And eating chicken doesn't predispose to it. But red meat, both pork and beef, is a major predisposing factor.
Would that also include something like lamb chops, for instance?
Yes.
Okay.
Chronic inflammation of the colon, ulcerative colitis and Crohn's disease, we've already mentioned.
So they need to be evaluated more often. I see these patients in my practice because I take care of a lot of joint problems, and oftentimes joint difficulties and swelling are associated with those inflammatory bowel diseases, partly because of genetics, I presume.
Right. Yes. And so if one has one of those illnesses, then surveillance should begin at an earlier time, and particularly frequently after 10 years of the disease. Heredity, we've already mentioned. If you happen to be one of those 1 to 2% of people with colon cancer that have the hereditary type of disorder, then surveillance should start probably at age 40 or even before. And all of us have friends and people that we have known that have developed colon cancer at an early age, and most of those cases are of this hereditary type.
So maybe even before age 40, because the friend that you and I know had it at age 37.
Yes. People who eat a diet that is low in fiber have a higher incidence of colon cancer, and recent findings show that people who have low vitamin D levels and low folic acid levels, 2 of the B vitamins, have a greater risk of colon cancer.
So vitamin D.
Vitamin D.
And folic acid.
And folic acid. And also calcium. Calcium seems to be a preventive for colon cancer, and the reasons for that are not well understood, but a number of studies have shown that.
Well, we can kill 2 birds with 1 stone, or I mean save 2 birds with 1 stone.
Right.
So throw it to the side. Be sure that you're aware that you need good vitamin D and calcium intake, which will also prevent osteoporosis as well as colon cancer.
Correct.
That's interesting information. I wasn't aware of that.
And the last predisposing factor that has been well studied is alcohol use. People who use alcohol on a regular basis have a higher incidence of colon cancer.
Now, by a regular basis, could you define that a little more for us? I mean, is this two drinks a day?
Yeah, daily use of alcohol in any amount.
In any amount?
Yes.
Well, they keep telling us to take 1 or 2 glasses of alcohol a day to prevent heart disease. What's the story here?
Well, that's a whole nother subject that we should
maybe
probably
10 of them.
devote a session to. But the The relationship between alcohol use and cancer in general is an area that has been studied extensively in the United States. And there are many types of cancer that are increased and that predispose to cancer and with alcohol. Ovarian cancer, cancer of the lung, a number of the major types of cancer.
Liver, pancreas?
Liver, pancreas. All of these are more likely to occur if one uses alcohol.
Well, that's an area that we do need to address maybe multiple times as time goes by, because we keep hearing this story, and I think somehow or other the media and people who, obviously those who like to drink, love to hear that story.
Sure.
But it seems to me that we're going to have to look at several aspects of this, the statistics, the other things that are going on, and one thing that I think our listeners need to know that really will help our audience understand what's going on here. When you hear something on the press, it's usually a single study about one end result. And
Yes.
here we're talking about these reports about heart disease and oftentimes deaths from heart attack. And so all we're hearing about is one mortality experience here.
Yes.
But I want to see us look at all-cause morbidity.
Yes.
Because that would include the people who are out there driving drunk and killing people,
Right.
those who are having broken homes or shooting up neighbors, those that are having abuse problems. I mean, you have to look at this whole thing globally.
That's right.
So here's one further bit to add to that. If you drink alcohol, you're going to have cancer of many kinds. You may have a little bit less heart disease, but that has to be looked at. There's other ways that you can prevent that heart disease.
Yes, I would agree with that.
So then in prevention, let's get back to that fiber business. We talked about it briefly, but fiber seems to be something that we can all get into the system relatively easily, but just takes some attention and some daily understanding of what we need to do. So tell us a little bit more about what kind of fiber intake we would need to really do this prevention thing with colon cancer.
Well, studies on a worldwide basis have shown that people who ingest an amount of fiber of something on the order of 30 to 40 grams per day have a significantly lower incidence of colon cancer than people who eat low levels of fiber. And those studies have been done for many years now in many parts of the world. We don't know exactly what the mechanism for fiber's prevention of cancer, but it is thought that perhaps one of the mechanisms is that the contact time between a carcinogen, a cancer-causing chemical, and the lining of the colon is much less when you eat a high-fiber diet than it would be otherwise, because the material that goes through the GI tract goes through much faster and therefore has a lowered contact time with the colon mucosa. And so a high fiber intake not only speeds transit through the colon, but it also dilutes the contents of the luminal content in the colon so that it is less potent in terms of a cancer-causing irritant.
That makes a lot of sense then. If you have the material moving through faster, which fiber helps us to do, that's a great benefit. And in looking at these incidence figures around the world for colon cancer and diverticulitis and appendicitis and so forth, in the countries where people are eating a lot of fiber and not so much of this high meat, high protein diet, they have almost none of those problems.
Yes, that's correct.
So that's something we need to adopt then.
Yes.
So how am I going to get 40 grams of fiber a day?
Well, that's a good question. Should I give you a menu for a day?
Well, just a general principle.
I think the idea is that you should attempt to get at least half of your day's fiber in with breakfast, because that's the only meal at which Americans eat cereal grains. And cereal grains, whole grains, are a major source of fiber. And without that source of fiber, it's difficult to get that much in your diet. And so having a high fiber cereal at breakfast time and adding to that some type of a fruit such as berries, blackberries, blueberries, raspberries, whichever berry you choose, all berries are high in fiber, will get you off to a good start and get in half of that day's amount just from that source.
Sounds like a delicious breakfast besides.
Yes, it's a good breakfast, it's a tasty breakfast, and it's a healthy one. And then eating more foods from the legume family. Legumes are a class of nutrient that are very high in fiber and also high in good quality protein and low in fat, and have many nutritional benefits because they're a very rich source of phytochemicals.
And no bad fats. I mean, there's no
bad
trans fats, no saturated fats.
Right.
It's all vegetable fat, so it's great.
So eating lots of legumes, lentils, beans, garbanzos, peas, things of that sort, those are a very healthy source of good fiber intake.
You know, we both spent some time in Japan, and I remember eating the edamame, which I think you can get now as an appetizer in the Japanese restaurants.
Right.
So edamame is a soybean, sometimes in the shell, and you can buy those frozen, and we eat quite a bit of that.
Yeah, yeah, that's good. So it is possible to get 30 to 40 grams of fiber relatively easily if you read labels and practice those kinds of principles. I think it's relatively easy to do.
And you need to stay away from a lot of the red meat too, and if you're going to be eating meat, of course, sounds like fish and chicken would be a little better.
Yeah, a number of studies have shown that a high soybean intake tends to prevent colon cancer. So substitute for your red meat a soy product, and that'll do two good things for you.
But tofu won't be a whole lot of help, did you say?
Well,
before?
tofu's a good food, and it has a good quality protein, but it doesn't have much fiber.
Doesn't have the fiber. Well, let's talk a little bit about the symptoms then. What kind of symptoms should we be worried about relative to the possible occurrence of colon cancer?
Well, most patients who have colon cancer have no symptoms at all. Some patients will have bleeding, and if blood is seen in the stool, that's a very serious warning sign that means do something about it right away. But most patients don't have any symptoms. If you wait until you have symptoms, you have waited until you already have metastases in most cases.
It reminds me of the lady that went to the doctor and was so sure she had cancer. And he said, well, why are you so sure? I don't have any symptoms. These people tell me that the first sign of cancer is nothing. So you've got to be careful.
Yeah.
And certainly not worry too much, but be aware.
Yes.
So you want to see your doctor if you've had any bleeding in the stool. How about change in bowel habits?
Change in bowel habits certainly can be a symptom of colon cancer. For instance, if one were to suddenly develop constipation when you hadn't been troubled with that before, that could be an indication of an obstructing process, and so that would mean you should have an examination.
And how about if the other side occurred, if you had been relatively normal stools and then started having more diarrhea, would that be any relationship?
Yes, there are some types of colon cancer that can do that. The mucinous type carcinomas can cause loose bowel movements, and so that too could be an indicator.
So how long would one need to be having this change in symptoms before you got concerned about it and went to see the doctor?
Well, I would say the sooner the better. I wouldn't wait. I mean, if you have rectal bleeding, see your doctor right away. Don't wait even, if you have to wait until you can get an appointment, that's the longest you should wait.
Sometimes that takes 2 or 3 months.
That may be a while,
so
right.
You might need to go to urgent care in the meantime, maybe?
Right.
Or...
And if you have a change in bowel habit, I would say that, if that goes on for 2 or 3 weeks, you should look into it.
We all get these changes from something we've eaten, we think, or maybe
Sure.
from a GI bug or a virus or something. So 2 or 3 weeks would be the longest you'd want to postpone that kind of visit.
Right.
Tell us a little bit more about the diarrhea side of things. What could be a problem with diarrhea other than just bowel cancer?
Well, diarrhea, of course, can be caused by lots of different things. One of the common causes of bowel movements that are loose is lactase enzyme deficiency, the enzyme necessary to digest lactose, which is in all dairy products. And many, many people suffer from that. That can cause both excess gas and diarrhea, and in some patients it can cause severe crampy pain as well.
And that can come on at any time in life,
yes.
More as the years go by?
That's correct. That's correct. And other things that can cause loose bowel movements, of course, are infections. There are a whole host of bugs that can cause diarrhea. We're all familiar with salmonellosis and typhoid and cholera and those kinds of bugs.
But those are from going overseas mostly,
Yes,
aren't they?
right.
That's not in the United States.
They're uncommon in this country. One of the bugs that causes diarrhea in the United States, and that we've been hearing a lot about in the news recently, is the E. coli 0157 infection. That is a bug that is the cause for traveler's diarrhea that you used to get when you went to Mexico or to the Latin American countries, or traveled in Asia or Africa or many other places. It is now a fact that that bug is endemic in the United States because it has become a part of the normal flora of most of the cattle in the U.S. And so contamination by cattle manure of vegetable products has caused major epidemics in the U.S. within the last couple of years. You've all heard about the spinach contamination problem. And while this can cause diarrhea, this can also cause a much more serious illness, often referred to as the hemorrhagic uremia syndrome, that can actually cause mortality in children and older adults.
That's kind of scary.
It is. And so the U.S. Food and Drug Administration is really, and the Department of Agriculture are really wrestling with this problem right now. And they have concluded that a number of guidelines should be followed to avoid infection with this bug. One, you should never use raw manure as a fertilizer for your vegetables.
Well, I thought that was organic farming.
It is, but it's no longer healthy. You should avoid foods that are grown within a couple of miles of a cattle lot.
How in the world are we going to tell that?
Well,
they don't say that on the label.
You can't. And that's a big problem. And they're really wrestling with that now in the government to try to figure out a way to deal with that issue. You should avoid, you should be very careful to wash your hands thoroughly after petting animals. And there have been several outbreaks of this infection from petting zoos, where children have been infected by going to a petting zoo.
So it's not just cows?
No, it's not just cows. The bacteria can be resident in many types of animals. And so it's a big problem that we really don't have a good solution for. I think washing one's foods carefully before eating them and cooking things thoroughly are other things to keep the infection from being a problem.
Almost sounds like we have to pretend here at home that we're in a third world country.
Well, it's sort of come to that. I was really amazed just recently when I saw a study that where they sampled cattle populations around the United States, and they found that most of them had that bug as a part of their normal flora now.
Wow.
Which is a new development.
I guess we could be thankful that it hasn't shown up in a wider range of,
Absolutely.
of things that we buy over the counter.
Absolutely.
We hear about these in the news, of course, but we don't hear about it every week by any means.
Right.
So it's relatively uncommon, but certainly the potential sounds pretty high.
Yeah.
So what do you think about having animals and babies together and so forth? I mean, having the kids playing on the floor with these animals, I mean, you can't get them to wash their hands very well.
You know, that's a tough question, and I don't really know a good answer for it, Ed. I wish I could say it's not a problem, but I'm afraid it is.
So at least we need to be aware and pay a lot of attention to personal hygiene.
Yes.
Over the past few years, I've become more and more aware of this, and I've thought in the past, well, you know, these obsessive compulsive people that are always washing their hands,
Yeah.
I've become one. But I've gotten to the point where when I'm in a public place or I've shaken hands, for instance, especially if I'm going to be eating, I will go and wash. I think people wonder if I've got some other problems. I keep running to the restroom.
Yeah.
But I think that's something we need to be aware of. It's
And
certainly.
I think using the hand sterilizing products that are available now, which are very effective, by the way, and
I'm glad you mentioned that.
I think that's another way we could avoid this problem.
The hand sanitizers
Yes.
need to be more a part of what we do.
Right.
I've kind of wished that we would take up the Japanese habit of bowing when they meet each other and being cordial and friendly by bowing instead of always having to shake hands, because I'm not sure what we're transmitting back and forth here. So, and the other thing is too, in the restrooms, you know, to get in and out of a restroom, you've got to touch so much stuff that everybody else is touching, and I don't see them washing much.
Right.
So I've gotten pretty particular about that. I'll go and wash, and I'll take a paper towel and hold the door handle and so forth. So there's a lot of things that we can do to help prevent some of these things.
You know, another cause of diarrhea, Ed, that we aren't troubled with a great deal, but which is an endemic issue in the United States and much of the rest of the world, is infection with Giardia lamblia, a parasite which exists in most streams and rivers in the world, and which can cause a diarrhea syndrome that is difficult to deal with. It is treatable with an antibiotic, but a better way to deal with it is to make sure that your water, when you're backpacking or camping or whatever, is filtered, or that you have sterilized it with iodine, or that you've boiled it or something like that, rather than take the chance of getting Giardia. When I was doing a trek in Nepal a few years ago, we ran into dozens and dozens of people trekking there who had that problem. If I had had a supply of antibiotic with me, I could have made a mint. But
you could have paid for your trip over there.
But I tell you, it is a problem, and it's no longer possible to drink from a mountain stream and be safe.
Yeah. Well, we've talked a lot today about various things that we need to do to stay healthy, wealthy, and wise, and we hope that you take these things to heart and put them into your living, and remember, a merry heart doeth good like a medicine. We'll see you again on Healthy, Wealthy, and Wise.